Dr. George, what would you tell a patient who asks the question, what is a mammogram and how often should I have that?
A mammogram is an x-ray of the breast. Just as you may have an x-ray of the chest when you're having a cough, that is exactly what it is, an x-ray of the breast. And you should have a mammogram annually starting at age 40. If you are a high risk individual where your first degree relative had breast cancer, you can start having your screening mammogram 10 years earlier if your first degree relative had breast cancer under the age of 50. So if your relative had it at 45, you can have it at 35. The other thing with mammograms is that people are often concerned with the procedure itself. You know, when you think of having a machine come down, you put your breast into it and it comes down and and smash your breast inward, top and bottom. It gives you that sense of wow, that must be a press. It must be painful. So I think people anticipate the pain. Um, and what we are seeing now with the new advances in technology, with the 3D tomo mammogram, the time that is needed to actually do the mammogram is much shorter, less intense, less intense than the previous 2D mammogram. And people are actually saying it's not that bad at all. So even now, I'm very pleased to say that a lot of the pushbacks that we used to get with people saying I don't want to have a mammogram, they're actually liking it. So I think the best thing we can do as providers is to prepare the patient for the procedure. Let them know what to expect. I often tell them don't wear any perfumes, no deodorant, no lotions. Come prepared. If you have any rashes or anything in your breast, make sure you let the mammography technician know this so that they'll know that there's something else going on with your breast that can cause pain outside of the procedure, so that they will determine if it is wise to do it at that time or to wait for the breast to heal. I think that is important because sometimes women may come for a mammogram and they have an active breast abscess, or they may come for a mammogram and they have a fungus under their breast. And I think it's important that they divulge this information to the technician. Also, mammogram detects calcifications. What an ultrasound will detect would be the mass, but the mammogram detects calcifications, which is fine little dotted calcium deposits in the breast. So it's so important to have that mammogram because you can't feel calcium deposits. You know, even though we do our self breast exams and our clinical breast exams, we could never feel calcium deposits. And the mammogram is the only imaging that can detect that. So I really say it's great that we have this technology and that we have the 3D tomo technology, which actually cuts the images in 8 to 10 slices, which is even finer than the 2D, which actually detects more lesions in a dense breast. Where when we did a 2D mammogram, we used to have to do a follow-up breast ultrasound because a woman had a dense breast. Now we're seeing that with the 3D tomo mammogram, we don't need to do a breast ultrasound because the 3D is cutting straight through the image and showing the breast very clearly. So many women are disappointed and telling me, Dr. George, I'm not getting my ultrasound. I said, that's because you don't need it.